It is the #1 health reason that keeps people from doing their jobs. Back pain can be a pain in the back.
That's true, but many people are getting back on their feet thanks to revolutionary surgery. Welcome Dr. William Hunter and Dr. Michaux Kilpatrick from Neuroscience and Spine Center of the Carolinas. Welcome to both of you. Thank you so much for being here.
Thanks for having us.
Dr. Hunter, we'll start with you. How common and prevalent is back pain? We mentioned it affects so many people.
Colleen, back pain is the #1 reason why people go to the doctor's office initially. 8 out of 10 people can actually have back pain in their life.
Big cost. People worry. You think about your back, you're going to be out of work for a long time.
Paul, the #1 reason why people have the expense that we have as far as healthcare is concerned is because of back problems. We're talking about $1 billion, tens of billions of dollars dedicated because of lost time with work, and trying to treat it as far as rehab or even surgery that's needed.
When you talk about so many people too suffering from back pain, is it lower back pain in particular? Is it upper back? Does it kind of run the gamut?
It runs the gamut, but typically we're talking about lower back problems.
Why is that so common?
It's a great question. If we knew that, we could certainly help a lot more people. But it just happens to be, a major problem in society, and there's some new and exciting things that we can do to help.
What are some of the advances?
Well, one of the latest advances is minimally invasive surgery, which allows us now to do spine surgery through small incisions. Smaller incisions allow for less tissue destruction, less blood loss. With less blood loss, that's less risk from surgery, faster recovery times. It used to be you would have a spinal surgery and you might be in the hospital for a week or so. Now people are having spine surgery and leaving the same day, if not the next day.
That's remarkable. We're looking at some video right now. Can you talk about the spacer that goes into the spine? Dr. Hunter, I know you've actually shown that to me before. It's incredible. It really is. This little itty bitty thing, either one of you.
Right, so we use the spacers when we're replacing discs. Discs in the spine can be a source of back pain, and sometimes we have to do a surgery where we go in and we remove a patient's disc, and then we replace it with that spacer you were mentioning. And now with new advances, your disc, Colleen, might be a different size than your disc, Paul, or Dr. Hunter's disc, or my disc. And so now we can custom fit that spacer to fit your disc space.
Wow.
That's
like
incredible.
Dr. Scholl's, right? Customize that thing. Well, but when you talk about back pain, I mean, virtually, if you go through life, at some point, you're having back pain.
8 out of 10 people do. They really do. So it's a problem. So we need to kind of come up with new advances on how we can actually treat the patients better so that they get back to their families, get back to jobs if they want to.
Neuroscience and Spine Center of the Carolinas, by the way, is hosting a seminar on the prevention and treatment of back pain. Here's the information if you want to grab a pen and a piece of paper. It's Thursday, November 8th from 6 to 8 in the evening at the Gastonia Convention Center. There will be a host of guest speakers, including NBA Hall of Famer Bill Walton. Call 800-745-7099. Again, 800-745-7099. Again, Thursday, November 8th. Thank you so much for being here. I hope people will take advantage of that to learn more information.
Thanks.
Thank you for having us.
Good to see you.